everyone. If I could start with first acknowledging the traditional custodians of the land on which we're meeting today, the Ngunnawal people, and pay my respects to elders past and present. I want to acknowledge their continuing connection to land, sky, water and country, and also acknowledge that this has been a place for tens of thousands of years where people have met, have listened and learned from each other, and I'm really grateful to have the opportunity that we can all do that together here today. Thank you very much, Rick, for inviting me to give this presentation. It's a little bit daunting to think about the future of corrections, and as we go through this, you'll realise kind of why I, at one point, probably thought I would never be talking about corrections at this stage of my career. So I thought I might start a little bit with a personal story before I get into what we're really doing with the Transforming Corrections Transform Lives Centre. And that's because in the course of my work, I've been asked many times how I got into this area of research and whether I have lived experience of incarceration, whether I've had a parent go to prison. The answer is no, but I do want to share a little bit about my journey so that you can see why I'm so passionate about the work that we do. And I think it all kind of comes to this quote that was in Glyn Davis's essay on Life's Lottery. Birth is a throw of the dice. The consequences can last a lifetime. If you believe people deserve an equal chance to prosper, this game of chance is deeply disturbing if nothing follows to even up the inherent unfairness. So for me, I was pretty lucky in life. I came from a family that provided a lot of love and support. We didn't have a lot. We lived in the outer suburbs of Melbourne. I went to a very mediocre state school. There was a lot of disadvantage around me, but I had a safe home to come home to at the end of the day. I had food on the table. I never worried whether I would still have a roof over my head or not, or whether we'd be safe in our home, safe from violence and so on. But those people around me that I grew up with, they did face those challenges. So I had friends who had parents in prison, parents whose children whose parents were absent because of mental health problems, serious substance use problems, and they banded together a lot on the streets at night. They were like a family to each other because they didn't have a great family to go home to. And I saw them get involved with the police from a pretty early age and saw the way their paths were going. Now, I wanted something really different for myself, but I saw that I could easily be on this pathway as well. But I had that opportunity to study. I focused on my schoolwork and I wanted a different life for myself. And I knew that I could do that because I had that safe home where I could study. But for most of my friends, they didn't have that safe place to be. And when I was probably about 15 and met with the school guidance officer, they said to me, "What do you want to do when you finish school?" And I said, "Well, I want to go and study law." And they said, "No, you need to lower your aspirations. Kids from this school don't become lawyers. Have a think about it, come back next week and think about if you'd like to be a childcare worker." So luckily, I am a fairly stubborn person. I'm also a bit of an optimist. I believe that we can bring out the best in people all the time. And so that wasn't good enough for me, and it just made me even more determined to study hard. But it did make me reflect and think, if I was in a different circumstance, if I had more people around me telling me that I couldn't do this, that my opportunities in life were going to be set because of where I lived, because of the school that I went to, because of the family that I came from, then that would be really shut down somebody's opportunities in life, shut down their aspirations for life, and really shift them onto more negative pathways. And I've always reflected on that. So when as I progressed, I decided I didn't want to become a lawyer. I wanted to become a forensic psychologist, and I was really curious about people's pathways into offending because I started to think that they were more complex than maybe what we hear in the media. Now, my first time going to a prison, and believe me, I didn't think I would ever go to a prison because I worked so hard in my teenage years to never have contact with a prison, was Ararat Prison back in 1996. So that's when the Gen Zs in the audience were being born. But this was, I was in my honours year studying psychology, and I remember that 3.5 hour drive from Melbourne to Ararat Prison. That's the one up there in the left-hand corner. And when I turned the corner and saw that prison in the distance, my stomach just churned. Like, I thought, what was I ever thinking that I wanted to do research in a prison? I wanted to turn around, I wanted to go home, but I couldn't. It was halfway through my honours year and I needed to collect my data, so I pressed on. I spent 5 weeks at that prison. I stayed in the officers' mess at night because it's too far to drive back to Melbourne. So I went home on weekends, but the rest of the time I was based at the prison. And I don't think that they would let anybody do that these days. But it was a really life-changing experience, I have to say. It was a prison that was predominantly filled with people who'd been convicted of sexual offences. So it was challenging in terms of hearing their stories. It was challenging in terms of thinking about the impact of their behaviour on victims. But it was also a place that was just filled with such despair. I came away from that thinking, I don't know how anybody could ever leave that kind of environment and make a positive change in their lives. So at that point, I was pretty set that I was never, ever going to do research in prison again. I wanted nothing to do with it. I was going to chart a different course for myself in psychology. Later on, after my PhD, I came to Griffith, and at that point in time, I met Professor Ross Hommel. He had a huge impact on me in terms of his work around pathways to prevention, developmental and life course criminology. And I thought, here's something I can really sink my teeth into. I can start to focus on preventing young people from moving into the youth justice system, from moving into adult corrections. And that's really where I saw myself based. Until about a year into that process, I met somebody who was working with families of prisoners. They were an NGO. They were at the time called the Catholic Prison Ministry. They were providing support to people exiting prison and also the family members who had a loved one in prison. And she came to me and said, look, we don't have any research to really guide what we're doing here. We have a lot of mums with partners in prison and they're really worried about their children following the same footsteps as their dads. What can you do to help us figure out how we can best support these families? And that was more than 20 years ago, and at that time there was really not a lot of research around families of prisoners. Something just lit a fire in me. I think it was joining the dots between my own experiences as an adolescent and then the idea that for these young people who didn't just have, and I don't mean to say just, the experience of having their parent removed from the family home in prison and the stresses that come with that and the economic insecurity that comes with that, the stigma that comes with that, but that we understand that that's just the tip of the iceberg for those families. There has been many challenges that have come along before that person has gone to prison as well. And so that really was the beginning for me of what became the next 20 years of my research and how we've got to the Transforming Corrections to Transform Lives work that we're doing now. And I think when we get through the work, you'll see, I guess, why we're driving it in the way that we do and why we have the values that we do that underpin it. That photo there, by the way, is Ararat Prison today. It's now called the Hopkins Correctional Centre. And I included it because I think it's also, if we think about the future of corrections, we're also really thinking about the future of the way that we work with people in prison, the humanity that we need to bring into that prison environment that hasn't been there in the past. And it's as much as I am against building new prisons, the one positive that comes out of these new prisons is that they are built in much more humane ways that are designed to provide a better rehabilitative context for people and for people's families to be able to come and feel valued when they visit. Now, that's how they're built. The second challenge is how they operate. And we'll talk about that as we go through it. Because I'm supposed to be talking about the future of corrections, I thought we should just probably say, well, what's come before us and what are we moving away from? So what can we learn from history? Well, first of all, I'm not going to go through the long history. It's not Corrections 101 or anything like that. But we know that harsh punishment, hard labour, solitary confinement, those practices that have been around for the last couple of centuries do not work. Thankfully, we're moving away from that, though we still live in an environment where there is a very large tough-on-crime approach to policy, and we should never forget that we can easily slip back into these practices quite easily. We know that poor prison conditions hinder rehabilitation, but we also know that some rehabilitation programs work, right? So unfortunately, we do not have enough evaluations happening around correctional programming, but for those programs that have been evaluated, we know that there's a number that work. We know that CBT programs and things like that can be really positive. Really good re-entry programs can also make a big difference to people succeeding post-release, and some educational programs can be really transformative as well. But the challenge for all of these programs is that many of them exist in environments which are I guess, isolated. So isolated from all the other challenges that people face when they return to the community, and the fact that the conditions that they return to are often worse than the conditions that they left when they came into prison, because things typically get worse on every level for people. So apart from sometimes health sometimes improves if they get access to good healthcare. We know that criminal justice and social policies disproportionately impact Australia's First Peoples. We see that very sharply in Queensland, where I live now. And imprisonment has intergenerational impacts, and that's partly the focus of what I'm going to be talking about today as well. So that's what we've learnt. So where do we go? If these are the lessons we've learnt, what are we going to do differently going forward? Just a quick note, I'm sure you're all very familiar with rising incarceration rates over the last couple of decades, so I won't spend a lot of time there. But this afternoon I'm going to be talking about women's imprisonment and what we're doing to reform that area. So I think it's important to note that though women still make up the minority of the prison population, their rate of incarceration has increased more than men's over the last couple of decades. Now in Queensland alone, we're hovering around 1,000 women in prison on any given night. When you look back and you think, back in 1994, there were 840 women across the whole of Australia in prison. So that's a massive change. And in southeast Queensland, where all but one of the women's prisons are, about 30% of that population are First Nations women. In Townsville Correctional Centre, the only prison from the middle of Queensland upwards, 60% of the women are First Nations women. So that creates additional challenges in terms of the way we should be working, the way we think about how we work, and I will also talk about how we've taken that into consideration in the work that we're doing too. Now, I think because we are really talking about stories that bring to life the work that we're doing, it's really important to not just think about the individuals that are in prison and the type of work we might do with them, but where women have come from prior to incarceration. We know that women's journeys into prison are typically different to men's journeys into prison. They generally include higher, I guess, rates of victimisation, of child abuse and maltreatment, of domestic and family violence, both witnessing it as a child but also as the victim of it in adolescence and adulthood, and high rates of mental health problems and substance use problems as well. So this is an example of Kate, who was a mother in a separate study that we've been doing over the last 5 years, where we've been capturing the life histories of mothers in prison. So Kate had her first child when she was 16 years old, and then she had another when she was 20, and 2 more just in her mid to late 20s. So throughout her life, she basically from her early teens onwards, she experienced mental health problems, so depression and anxiety. And at different points in time, she used medication, both prescribed and non-prescribed medication, to manage that depression and anxiety. If we jump to the top of that graph, you can see that there were significant periods in her life where she was using substances on a daily basis, so marijuana, speed, cocaine. in her early 20s, and then later on in her late 20s and into her 30s, she was using, again, marijuana, speed, cocaine, but also now methamphetamines. And methamphetamines is one of the highest, disparities amongst women who are in prison in terms of the rate that I think it's about 60% have used methamphetamines in the year prior to coming into prison, compared to less than 1% of the adult female population. So it's a stark difference there. She was drinking moderately in her early 20s, but by the time she was about 23, she was drinking quite heavily on a daily basis. She had major health problems at different periods of time. She had a number of hospitalisations and surgeries. During this whole time, she experienced a lot of housing instability. So across her 20s, she moved houses 27 times. In those later years, she spent about 3 months of each year couch surfing, living in her car and living on the street. So, and I should point out, she had her children with her during all of these periods of house moves and housing instability. She experienced serious financial crisis and debts. And as you can see there, she also had many years in which she was a victim of intimate partner violence, and described all 3 of her significant relationships as including excessive fighting. So that was her story leading up until the age of about 34, when she was arrested for a drug offence. She spent some time in rehabilitation, and that was the first time that her children were removed from her. They went and stayed with her. They were removed by child safety, but stayed with her grandmother. And then about 6 months after rehabilitation, she went into prison for 12 months. Now, I just want to share with you, we also met Lucy while we were doing this research. Lucy is her now, at the time, 15-year-old daughter. So when we interviewed her, we also asked about what she had witnessed as she was growing up in terms of the challenges that were in the household. She witnessed the alcohol use and substance abuse of her mum. She lived with her mum through all of those 27 house moves. She moved school herself 6 times until she was eventually expelled. She witnessed violence in the home, and she also witnessed the arrest of her mum. So when we met her, she had been being homeschooled by her grandmother for the last 12 months, but that wasn't going well. The grandma was finding it incredibly challenging and was just in the process of re-enrolling her at school and hoping that she would actually go to school at this particular point. So Lucy was very much on a pathway where she was not yet in the youth justice system, but was very close to it, and her grandmother was very worried about a boyfriend that she had and some other young people that she was hanging out with. So if we think about these stories, and they are snapshots of somebody's life over time, and they don't do any justice to what that actually felt like for either Kate or Lucy to live through that, then what we're faced with is thinking about what it might actually take in a correctional system to do things differently and to meet the needs of Kate and Lucy as examples of other mothers and children who experience this. So I'm just proposing that we all want the same thing as what they would want. We would all want, and Kate also wants, to leave prison and not return. She wants to have a better quality of life. She wants to raise and nurture her children and succeed at all the things that are important to her. And Lucy doesn't want to follow in Kate's pathway into prison. Lucy wants to have the necessary supports to address trauma, stay engaged in school and learning, and believe in and reach her potential. She wants a good relationship with her mum, and for her mum to be a source of strength and support for her in her life. And that we all want to break that cycle of disadvantage, victimisation and offending that we see in so many of these women's families. So if we use that as our starting base, it's then about thinking about, well, what would a future look like in a correctional system? And that's where we come to the work that we've been doing in the Transforming Corrections Transform Lives Centre. Now, I was really fortunate that I had spent a good deal of my career doing research in this area, both with interviewing parents in prison, interviewing caregivers on the outside who had partners in prison, interviewing children about their experiences and working with different stakeholders over time. And so had really been starting to build up a picture of what might be needed. I really found it frustrating, though, I have to say. I didn't have a clear solution as to what we would do. I just knew that a single program for parents in prison or for families on the outside was not going to significantly change anything when we look at the entrenched disadvantage and challenges that so many of these families are facing. So that was kind of where I just felt like I had this problem that I just nutted over all the time and couldn't come up with a solution. I had the opportunity to meet with some people from the Paul Ramsay Foundation around this period of time, and they said to me that they were starting to look at investing in breaking. The Paul Ramsay Foundation is one of Australia's largest philanthropic organisations. They do work that is focused on breaking cycles of disadvantage. And they said that they were starting to look at the criminal justice system as an area where there is a lot of entrenched disadvantage. We had a number of conversations, and I was really fortunate that they said, okay, if we fund you to design a model, can you come back to us in 12 to 18 months' time with a model of what this would look like to do something differently with families to break this intergenerational cycle? At that point, we decided to focus on mothers. It was partly strategic because really looking at the political space in Queensland, but also around Australia, it was always going to be challenging to start working with fathers in prison first and working in the men's correctional system. That if we could develop a model that worked with women, we might just be able to then slide it across and start to think about how that would work with men, and then also taking into account the many challenges that women are facing as mothers and the intergenerational impact of their incarceration when they're children. So I'm now going to describe to you what we did in terms of designing this model and then how we're taking it forward. So I won't go through this. This is that intergenerational cycle of risk, offending and incarceration that I think we all understand and appreciate how that works in terms of those precursors, and we can see that in terms of the precursors of Kate, but also those emerging precursors for Lucy as well. We also know that incarceration entrenches disadvantage, and for many women, they leave prison with absolutely nothing. So whatever they had was stolen or given away when they came into prison. It was put out on the nature strip and taken away. They can't afford storage. They generally don't have partners that are going to store things for them. So they are leaving with nothing, and they are trying to re-establish their lives again, trying to reunify with children who are often under care of child safety as well, and trying to find a house, furnish it. Massive challenges for mothers, as well as then dealing with other challenges that they're facing around substance use, mental health challenges and so on. So it really significantly impacts women and what their pathways are going to look like afterwards, creating further risks for them, and then that cycle continues throughout generations. So we started by doing a series of workshops. We started by saying, look, we have all this research that we can fall back on, but really where we should be starting is we should be asking women themselves in prison, what is it that they actually need? So let's start from scratch. Let's clear the deck and say, let's not make any assumptions. It's not about what we think, and it's not about what's been done before, and it's not about what corrections could have an appetite for or couldn't have an appetite for. Let's just say anything is possible. So that's what we went into it with. And we did our first round of workshops with mothers in prison around every women's correctional facility in Queensland. We had about 65 mothers in those workshops. And they were in small groups, 4, 5, 6 women at a time. And we did these workshops where we asked them really 4 main questions. First was, what did life look like for you before you came into prison? We also said to them, you don't have to talk about your own life. If you want to talk more generally, you can talk about what you know of women's experiences in prison. All women talked about their own lives and were kind of really open and frank about what that had looked like. We asked them what the first day in prison looked like for them, what that first week looked like, what did they need during this time, what did they worry about during this time, what would help them during this time. And then we kind of stepped it out then. We said, okay, now during the time that you're in prison, what is it that you would need to be able to be prepared for release, to have a different life? And they we really delved deep into that in terms of what that looked like across lots of different domains for them. What emerged was really an ability to develop strong relationships with their children or repair relationships with their children and family members, an opportunity to engage in healing and address trauma, and also an opportunity to prepare for release and be supported upon release. Those are really the three things that they, if you boil it down, that they were asking for. And then we also asked them what did they need when they got out of prison, and we asked them to be really explicit about that as much as they could. 70% of the women in our workshops had been in prison previously, so we were able to say, what happened last time you were released? What do you think might have made a difference for you? What did you need that you didn't get? And then we also asked them what they hoped for the future. So what did they want life to look like in their future? What did they want life to look like for their family? And they were really, really modest in what they wanted their life to look like. They talked about having the opportunity one day to take their children camping by the beach. That would be an amazing family holiday that they'd never had the opportunity to do before. They talked about being able to make lunch boxes for their kids each day. And that was to have the food to put in the lunch boxes, but also to be there, present in their children's lives, to make those lunch boxes and take them to school. But we also had mums say, I don't think I can do that without a lot of support that I currently don't have and have never had before. So we did have mothers that said to us, my children are currently in foster care, and I think I'm better off leaving them there because I can't offer them the life that I want them to have without different kind of support. And I think that that's one of the absolute crying shames that we have in the system that we have, that there would be mothers who would be willing to have their children remain in foster care simply because they can't get the support that they need to be able to raise their children themselves. So we also did those workshops with stakeholders. We brought in people from across Queensland Government and also NGOs that were working in the space, either with mothers in prison or with children out in the community. And we also asked them the same questions. We wanted to know what did they think women needed? What did they think they needed at different points in time across their lives before, during and after prison. And we wanted to see where the synergies were and where there were differences as well. We then did a series of workshops that were focused on children and young people. We did those in the community with a whole another representative group across government and also NGOs that were working with children and young people. And that was really focused on understanding how children's needs were or were not being met, what the state of play was in the sector, how were agencies working together, what did they understand of each other's agencies, and what were some of the challenges that young people faced in order to access the supports that they needed. That's really this second workshop. The first workshop was a key part of the program we ended up developing. This second workshop was a key part of really honing in on the fact that systems change needed to happen. So what we had were a lot of agencies in the room who actually didn't know what each other were doing, who were duplicating services in some instances, who realised that they were probably serving the exact same people, but not appreciating that, or who didn't know what the other service was doing or how to hand over to a particular service. And then everybody cited barriers to information sharing. Everybody said, well, we could do this with this person, but we don't have this information to know what else is being done. And so this was cited over and over and over again, and it was cited over and over again in the mothers' workshops as well. And everybody cited privacy legislation. We can't share this information because of privacy legislation. So this was really part of what ended up as being a key part of our model. We then worked together as a research team to take all that we'd captured across these workshops. We had about 60, 70 hours of recorded workshop material that we had transcribed, we coded, we worked through it thoroughly, and we came up with a model. We then took the program aspect of that model back around the prisons again. So we went back to mothers in prison, did a whole other series of workshops around all the correctional centres and said, this is what we heard, you telling us, and this is what we came up with. Can you tell us what we got right, what we didn't get right, what's missing? If we can't get funding for it all, what are the critical elements that have to stay? What would you be willing to let go of? And we really asked them to be brutal and frank, and that this was their program as well, and that, you know, if they didn't think it was going to create change, then, you know, tell us now and tell us what we should be doing differently. They were really emotional workshops, I have to say. So we had a lot of women who cried at that particular point at the idea that there might be something like this offered at some point in time, and they realised it wouldn't be offered for them, that their time in prison would have come to an end by the time that we were at a point where we could implement something, but they were really hopeful for the future. So some of the women, just in terms of talking about the challenges that they were facing, really, this quote is really about how much they want to connect with family when they're released from prison, but how much harder it is for them to reconnect with family when the pathway back to old habits is so much easier. And for many of these women, about a third of women are homeless before they come to prison, and about a third of women will be homeless when they're released from prison. So we've got many women talking about going to boarding houses where drug use is prolific, walking the streets at night just so they're not going home to where they know they're going to be offered drugs and push drugs. But that it's really hard to be in that environment and to kind of survive in that environment past the first few weeks. And so that pathway back into prison is like a door just opening for them that is so much easier than the challenges that they're going to face to be able to be reunited with children. The other thing that we heard a lot and that did play a significant part in the model was the trauma associated with retelling stories over and over and over again to access all the different services. And I don't think that that's a surprise to anybody here, but that sense of kind of flatness in the way that many women come to talk about their lives and actually are often not believed about the life experiences that they've had because they've removed the emotion out of it. And that's just a survival mechanism. But it's something that was really key that needed to be eliminated in the way that we go forward, and that again came down to information sharing. So this is the model. I am going to talk through it. Don't worry that you can't read any of it right now, but this is what the complete model looks like. There is a Transform Lives program that works directly with mothers and children. There's a Transforming Corrections hub that is focused on systems change, and then there's research and evaluation that is embedded under every activity that we do to focus on creating an evidence base. So to take you to our vision, at the end of that design period, we took the model back to the Paul Ramsay Foundation, and we put a proposal together to trial this model for the next 5 years. I should also say at this point that corrective services were incredibly supportive the whole way through this work. So when we first had the opportunity to design the model, I went to the then Commissioner of Corrective Services, Peter Martin, and I said, I've got this idea about transforming the way that corrections works with mothers in prison. Would you support us doing this? We want to run it. It's not going to come from the inside, but would you support it? And he was very enthusiastic about it. So that was kind of the first step. We had a lot of alignment in terms of where we were at as a research team, the foundation coming along, and corrective services being in a point in time where they were really receptive to the idea. And I think that from Peter's perspective, he appreciated the fact that we were going to be able to take a lens to the system in a way that couldn't be done when you're working from within an agency. So he really gave us a lot of support and free rein to do all of these workshops, to come up with a model ourselves that wasn't a model that was co-designed with corrections. We did have some people from corrections along to our stakeholder workshops. And we were supported a lot because we did all those workshops during COVID, which was not easy when correctional centres were shut down to pretty much all research. So we had a lot of support in designing this. So our vision that we put forward was to support mothers and children to have safe, dignified and fulfilling lives, breaking down intergenerational cycles of disadvantage and incarceration by transforming systems and generating new knowledge for evidence-based programs. So we're trying to do a number of things there. We're trying to support mothers and children directly. We are very much focused on transforming systems, knowing that a program in itself is not going to change everything. But also we really need to address the dearth of information around evidence-based programming that exists in corrections. Our values that were really at the core of every decision that we make, both in designing the model but also in how we're developing our practice going forward, is respect for all people and their connections to community and culture. That includes First Nations people first and foremost in terms of the way that we're doing our work. And I should say a third of all the women involved in all our workshops were First Nations women. We had a First Nations scholar working in our research team, and we're building our First Nations staff base in the centre right now as well. The second value is that knowledge will support positive change, and then I guess also drawing on that respect is valuing everybody's knowledge. So the knowledge of those people with lived experience, the knowledge of people who are actually working in the system. And so we're not saying we're working against the system. We actually need to bring people along who are already working in that system and have a lot of knowledge about how things have worked, could work, where the challenges are right now, and also valuing that knowledge as well as obviously we're researchers, so we value the importance of creating an evidence base. We knew that we wanted to come to it with an empowerment perspective, enabling individuals to function at their best, but also systems. So, you know, we're never kind of just focusing on the individuals and empowerment there, which, you know, is clearly an important area, but also then thinking about how do we empower a system to work differently? And that's a really big question. I don't know if we've got all the answers, but we're trying. And then believing that transformation is possible for individuals and systems. So, and the systems change one is just as hard as the individual transformation, I would say, if not harder. But we have to believe that those are possible. So I guess I am an optimist in terms of what we can achieve. What somebody once said to me, another researcher said, you can't be an optimist. Researchers are not optimists. And I'm like, well, I'm an optimist, but I can be pragmatic at the same time about how we get there. So I just want to step through what the model actually looks like quickly and tell you a little bit about some of the activities that we're currently in. So we're just past the 12-month mark of this 5-year funding that we have, and a lot of the time has gone into the further development of this model, getting ready for implementation. So this is the Transform Lives program that has been developed with mothers to provide for mothers and their children out in the community. So we have Transform Lives coaches, so we just call them coaches. They are at the centre of the model. These coaches will work individually with mothers and their children for up to 6 months prior to a mother's release from prison and for up to 3 years post-release. So this is a significant period of time that goes well beyond what most re-entry programs are able to offer. And this was really about addressing, we know the significant challenges that women and their families have experienced prior to incarceration. We can't expect things are going to turn around for them in 3 months after their release, 6 months after their release. Or even, you know, necessarily 2 years. We know that about a third of women return to prison within 2 years of imprisonment, so we wanted to go beyond that. We've gone to 3 years to see what can we actually achieve. We don't know if 3 years is the right period of time, but we figure If you start further out and you realise, well, maybe it doesn't need to be 3 years, you can always pull it back in, but it's hard to start at 12 months and then justify why you need longer. So we really developed what we felt was like a gold star kind of program, where we would be really able to test, is this what it's going to take to make a difference? So it's a low caseload model. So we have in Southeast Queensland 4 coaches who are supervised by a program manager. Coaches are essentially social workers, and they will have, in their first year, they will have 4 mothers and their children as their caseload, and that will increase to another 4 mothers the next year and another 4 mothers the next year. So we imagine the first year working with mothers and their children is going to be the most intense year. And that's why they start with 4, and then by the time they take on another 4, and that's like 1 mother and her family every 3 months, not all at once, is that the intense period has hopefully started to decline a little bit by the time they take on more mothers and their children. So that's essentially the model. So it really allows coaches to work one-on-one. This isn't a program that is off the shelf in terms of exactly what a coach is going to do on a week-to-week basis. Their job is to get to know the mother while she's in prison, work with her to understand what her journey has looked like and what she wants her journey to look like after prison, to develop a case plan for that, and to scaffold what programs and services she's going to need to be able to support her, to start to bring those programs and services into the prison to support her, but also to ensure that when she's released from prison, she has a friendly face greeting her, she has somebody helping her re-establish herself, and she has somebody helping her connect to all the services and systems that she's going to need support for. So part of the coach's role is to work at a kind of individual trauma-based approach with the mother providing that healing that women have talked about, as well as counselling. We do have psychologists as part of the program as well. So if women need additional mental health support, we have psychologists that can come into the prison and work with the mothers before they're released, but also continue to work with them post-release as well. So this was all knowing that families don't get mothers don't generally get access to psychological support while they're in prison unless they're self-harming or suicidal, simply because of the number of women in prison and the available resources. So it's about us providing that kind of support and seeing where can we fill the gaps that are currently there at the moment. So we went into it saying we don't want to step on anybody's toes. We don't want to do services that already exist out there. We want to work with all the NGOs that are out there. We want to refer to NGOs that are able to provide particular supports, but we will help be the navigators. So coaches are also, one of the critical roles of the coach is to be a navigator for mothers, and this came out very clearly in our workshops, and we asked people, who do you think should be the navigator? Should it be somebody in government? Should it be a particular department? Should it be a particular NGO? And in all the workshops, government said, it can't be us, people don't trust us. People, all of our agencies are stigmatising to work with. NGOs said, well, it really probably shouldn't be us because we're in competition with each other for funding, and if somebody has this particular role, there's always going to be some friction. So we, as a university sitting somewhere, on the periphery of all of this, not government, not NGO space, said, well, this is probably a role that we could take for a while as system navigators and build this into the model. So that's what the coach model looked like. I'm not going to go through all the different aspects because I'm going to run out of time and I want there to be questions. So our intended outcome was really to improve those key areas that are preconditions for change while women are in prison and leaving prison, but then over time to create more stability and wellbeing around housing, relationships, employment, health, increase time to reoffend and reduce recidivism, but it was never just about reducing reoffending, it was always about improving the wellbeing of mothers and supporting them to achieve their goals. In terms of children, we know they fall through the cracks. So when I showed Lucy before, I should have actually said at the moment, Lucy's invisible in the system, right? So we talked about what we want Lucy to be able to achieve in life, but right now Lucy is completely invisible. There are some organisations like Shine for Kids, I should say, that provide support for children who have a parent in prison or a family member in prison. But more broadly, there isn't kind of really targeted support across government that recognises the needs of children who have a parent in prison and a coordinated response for that. So that's why I say Lucy's invisible. So what we want for these children that we'll be working with is to assess their needs. And so many of these children, we know that there are a higher proportion of learning difficulties and other neurodevelopmental disorders amongst children who have a parent in prison, but they generally don't get assessed until those kids hit the youth justice system. That's way too late. We can be doing a lot better at this while children are in school and getting them the resources and support that they need to be able to stay at school as well. So it's about assessing what they need, working to ensure that they are healthy, enrolled in attending school, engaged in school or some other educational setting. They have strong support, a strong support network, and are able to build that relationship with their mother if that's appropriate at the particular time that we're working with them. That they have reduced contact with the child protection system, reduced time in out-of-home care, and reduced risks for youth offending as well. And importantly, I should have put there, that their potential is unlocked for what they want to achieve in life. This is the measurement, and I'm not going to go through this, but basically we have a very deep research and evaluation activity sitting underneath the implementation of this program. So we implement in January in South East Queensland, that's this coming January, and in Townsville in July next year. So we have a client management system, we have QCS data that we're accessing, and we have all our own research measures that we have developed. And we have spent considerable time this year on the research measures, really preferencing how we are going to do research with First Nations women and First Nations families to ensure that we are putting that approach at the forefront of the way that we work. And then we look at, well, what else do we need to change anything to use these measures with non-Indigenous families? So that we've kind of flipped a lot of things on their head as we were working through this project. Quickly, because I know I should leave time for questions, but I do want to talk about the system change because I think it's so important. Really, the focus of the systems change work was on integrating service provision and improving information sharing. So these were the key things that came out of all of our workshops and the barriers to women and children actually accessing the services and supports that they need. We identified that there needs to be a lot more shared understanding of what the needs of parents and their children actually are. So there's a lot of services or departments that sit at the periphery of people that are involved in the correctional system, and I'm thinking about health in particular and education in particular, that have little to no understanding of what it means for a family to be impacted by incarceration. And so building that shared understanding so that all of those allied services and agencies that says this is not our core business actually develop an understanding of what this means. Integration of information, sharing of information, continuity of service provision for women, regardless of whether they're in prison, out of prison, moving communities, and also capability and capacity in the sector to deliver services as well. So in order to achieve these things, we developed three main bodies of work. One is a communities of practice that will commence next year, and this is about focusing on bringing together frontline service workers across all the organisations, both government and non-government, to start to work together to develop really good, for want of a better word, case management practices around how do we actually work to understand the holistic needs of women and children and work in a way that is coordinated to provide that support, but also putting women and children at the centre of that. I won't go into that in too much detail. The other area is training. So we are doing at the moment we are developing training for correctional staff, and that training is focused on enhancing the communication skills of correctional staff and a greater appreciation of women's journeys coming into prison, designed to generate more empathy for women and respectful engagement and maintaining their dignity while they're in prison. That was something we heard of a lot, that women have had removed from them, both before they came to prison, but certainly during their time in prison, and that it's very hard for them to see themselves as worthy of a better future when they're treated in a way that makes them feel really unworthy of anything. So that's our first piece of training, and corrective services are also supporting us in allowing us to roll out that training once it's finalised. It's in its final kind of months of development right now. We will later be doing training for education staff to be able to support children in schools, and also women asked us for communication skills training as well, to enhance their communication skills for engaging with their children, for in their relationships, and also for engaging in education and employment as well. The key part that I think is the clincher for all of this is the Systems Change Board. So this is a board that sits across government. We established this earlier this year. It is chaired by the Honourable Margaret McMurdo, who is a former District Court judge, and also was the head of the Women's Justice Task Force, which operated in Queensland over the last 18 months or so. So we're very fortunate to have her as chair. We have every government department pretty much represented on this board, and it's senior people. So we have the Commissioner from Corrective Services and Assistant Commissioner, and then across all the other government agencies we have people sitting generally at a director level of particular areas that relate to those people who would be likely to engage in either youth justice, employment, and so on, either who have been impacted by incarceration. So we have this board, and it's been set up in order to really tackle those big systemic issues. They are the things like information sharing, they're the things like a lack of integrated service provision, and we are working through a couple of pieces at the moment. So one of those pieces is systems mapping, and this was, crystal clear to us. It was something that we had to do in terms of nobody across all the agencies understands women's journeys through the system and how it brings them either towards or further away from their children during this time. So there was a lack of understanding both in terms of the women's journeys, but what that meant as a parent going through the system. So we have started the mapping, and you can't really see the colours that sit behind this map at the moment, but behind this map there are different shaded rectangles, and they drill down about 4 other levels at the moment. And what we're hoping to do is actually add data to this to actually understand the pathways and the decisions that are being made, which will help bring into sharper focus the levers that can be pulled as well. The green lines there are kind of ideal movements of a mother that keep her closer to her children, and the red lines there are the decisions that get made at different points in the system that move mothers further away from their children. So what we're looking at is ideal and non-ideal kind of movements, and movements of children to or from their mums as well. And then we take that down into many, many levels that I won't go through now. The other thing that we've been working on with the Systems Change Board is developing up a decision-making tree for information sharing. So I won't go through this in detail, but we've developed up our first case study and took it to the last Systems Change Board. And this was about a mother who had given birth to a baby in prison and had that baby removed. And there were a lot of precursors to that actually occurring that could have looked a lot different and produced a different outcome for Layla. Because of the removal of the child and her time in prison. By the time she got out of prison, she hadn't had contact with her baby for 12 months. She had no connection with it whatsoever. She never reconnected with that child. So what we did was we actually worked through where could information have been shared at different points in time for Layla in order to get supports that she needed, and what might have those outcomes been at different points in time for her. that was, I think, for the Systems Change Board, who are made up of people who, some of them have a very deep understanding of how corrections work, and some of them are sitting at the periphery. I think this was really enlightening for them in terms of understanding really what part their agency plays in this cycle of decision making. And so they have asked us to come up with another 5 or 6 case studies, and we are drawing these case studies from the women that we've already met in our workshops, so that they can better understand it, and they want us to develop that up as a tool that their frontline service workers can use for information sharing. So accompanying this that I'm not showing now is a decision-making tree that sits with legislation, but is about how you make decisions through all of these, through the key criteria that needs to be made. That aligns with privacy legislation, but does allow information sharing, because what we have discovered through all of this work is that yes, there's privacy legislation, but the problem is the practice, it's not the policy itself. So another area that we've been doing is we gathered all information sharing policies from all the departments that we've been working with to really understand what are their policies, what MOUs do they have in place across different agencies, what are their policies for information sharing, and what are their protocols. And so we've actually taken all of these and created a shared template. So they have said if we can trial this shared template with their frontline service workers with training associated with caseworkers, then this may well serve as a model, not just for how we work with mothers and children in the system, but how we could work with all people in the system, and even not just in relation to corrections, but information sharing for people who are trying to access mental health services, substance use services, and so on. So we're pretty excited about the work that we're doing. I think it takes a lot of collaboration. And I should say, our work has now been embedded in the new interim women's strategy by Corrective Services. So at the start of all of this, we were very clear, this is not about trialling something for 5 years and then stepping away from it. This is about taking every opportunity that we can while we're doing this work to embed it within the system, change the system, but embed it and make it really hard to change down the track, so that these changes are sustainable. We were engaged heavily with the Women's Safety and Justice Task Force when they were doing their work, and TCTL was a recommendation in that report, and that was adopted by government. So we have a bit of a platform to be able to do the work that we're doing. We also admittedly have significant funding in order to be able to do the work that we're doing, and that has created leverage for us to be able to bring together a systems change board like we have brought together, and to get that kind of engagement across government. It's a lot of work, I'm not going to lie. It's weekly being out there, talking to government, making sure that they stay engaged, and thinking about ways that we can really add value to the work that they're doing. I think at the moment it's a time of change in Queensland around the way that women are supported in corrections, but it's also I guess a time where we are able to kind of lead the way, and I hope that we can share this information as we go, and share all our findings as we go and lessons as we go as well, so that other jurisdictions might be able to, if this is useful, to use this as well. I was going to talk about partnerships and collaboration, but right now I'm preventing you from drinks. So I think suffice to say, you can see through this model that none of this happens by just a research team. We have a clinical team that we have been employing. We have enormous engagement from Corrective Services. So they were fortunate to get funding out of the Women's Task Force recommendations as well. So we have a committee within Corrective Services that I go to very frequently to ask for support to enable us to do the work that we're doing and to get ready for implementation. So it's great to have the resources there on the inside, and an absolute commitment and drive from the department to make this work as well, and an excitement across government of what this might mean. I think everybody working in government recognises that silos don't work. They're all working in silos, they're all frustrated by it. This is an opportunity to start to remove those silos and to see if we can do something differently in a very focused area, and then potentially expand that area. I think, look, I'm just going to end there in terms of when we think about a future for corrections. I'm not saying we've solved all the problems, but I think that it is definitely about kind of I'm going to skip to this one, about being imaginative, about thinking that anything is possible, and then designing that. Allocating resources and responsibilities differently. And I think that this is something that we'll be pushing over the next couple of years, definitely with Treasury, in terms of how those resources get funneled down, because at the moment corrections is held as responsible, and really it's a whole of government responsibility. As you saw from Kate and Lucy's story, they are engaged and need support from every agency. And so every agency should be contributing to this kind of work. It shouldn't be around, well, we've got money and we can pay for this, but we can't pay for that. Let's look at it holistically. And the last thing I think is this work needs to contribute to changing a narrative on crime and punishment in Australia, and we're really committed to sharing women's success stories as we go as well, because I think success stories are something we never get to hear about, but also working alongside other really important initiatives like the Justice Reform Initiative and things like that, that are working hard to change that narrative in Australia. We need to keep pushing at it. That's where I'll end. Thank you.